on the staff and caregivers of Children's Wisconsin.
You're listening to the Miracle Marathon for Children's Wisconsin. On Milwaukee's Classic Rock.
And welcome back. We're about to meet that 17, soon-to-be 18-year-old young man, right, Doreen?
Absolutely, Trey. And he is here along with his mom, Tratavia, and Dr. It's Brando is here, but spelled Brando. Not like the actor. So we are here to talk about Trey. And Mom, we'll start with you. Trey's your first, right? And so he was diagnosed with sickle cell at birth. Now, as a new mom, what are you thinking?
Well, I actually sickle cell is in our family, so I was kind of familiar with sickle cell, just the surface of it, not anything like the symptoms and everything that we're going through now. I just knew I had a sibling with it, younger. So when he was diagnosed, I'm like, oh, okay, I know about this. Only to get into it that I didn't know what I thought I knew. I didn't know the severity of his condition.
So tell us a little bit about it for those listening who may not know.
So sickle cell disease is a chronic illness that is mostly affected by African Americans. I do know they started the newborn screening in 1989. I want to say with sickle cell. So we were a part of a generation where they, were tested at birth. So we found out at birth. I was told initially that Trey would not start having pain crisis is one of the symptoms of sickle cell until he was maybe 6 months to a year. And I think Trey started his first crisis at 3 months. And as a mom, I'm panicking because I have a 3-month-old that is crying incessantly, and I didn't know that he was going through a pain crisis because again, I'm thinking that we're not going to start this, until he's 6 months to a year.
So he's an overachiever.
Yeah, he started a little early on us. It was a lot as a first-time mom having a child with a chronic illness that you know little to nothing about. There were times that I had to get on my knees and pray to God to give me the strength to just be strong for him. And it was just, he's always been like a firecracker when it comes to his sickle cell. Everything started early for him, earlier than they expected. So he went through a lot of his complications more so when he was younger than going through them at the age that they thought he would go through.
And then, Doctor, maybe you can help us a little bit too. So now you're talking about these pain episodes that he has. Is this expected through his whole life, or is there treatment, or how does a family with sickle cell go on and figure out life?
Yeah, it's a great question. And as Tratavia shared, they start early and the pain events last their whole lifetime, essentially, as long as they have sickle cell disease. The pain events can be very severe, and Trey is the best person to speak about the pain, so I won't speak about what he feels because it's really important to hear from our individuals who live with the disease what it feels like. But they do require multiple visits to the emergency department and to the hospital for treatment. Primarily, we treat them with opioid therapy and other pain medication, ibuprofen and some other medications. And we also know that people who live with sickle cell disease can develop chronic pain that occurs every day as they get older. We do have treatments that help ameliorate some of the pain. One of them is an oral medication called hydroxyurea that can be taken once per day. We also can give monthly blood transfusions, and those are reserved for selected complications because sickle cell disease is a multi-organ disease, we call it, because I always teach families anywhere blood goes can be affected. So blood touches every part of our body, so every organ in the body can be affected.
And now to the star of the show.
Yeah.
Absolutely.
Trey over here wearing that Converse All-Star t-shirt, which I want to talk about in just a second. But we talked about pain and things like that and pain management. How have the doctors and the staffers here at Children's Wisconsin helped you get through that painful stuff?
They helped a lot. They had showed me ways that can help me control my pain and everything, what medicine that would help. And so at home, if I'm having a pain in my back, I'll have to put a heating pad on it and see if that works. If not, ibuprofen. And then if it doesn't work, just come to the hospital and then check it out.
So you're wearing that Converse All-Star t-shirt. I bet you're a sports fan. And I bet you know there are many NFL stars who have been through this and who are spokespeople about sickle cell traits and things like that. Ryan Clark, who's been on ESPN, is a famous guy who has gone through that. What's it like for somebody who doesn't know about this blood disorder going through this stuff?
Actually, it's kind of like surprising because me like a lot of people that hasn't like don't know what sickle cell is, and so like explaining it to them, they be like shocked and like, why have you like talk about this topic and words like that, and so. Yeah.
Well, and now part of the funding that we use or that the Children's uses is for research. And you two were approached by Children's last September to see if you'd be interested in a new treatment. Can you tell us a little bit about that? Either one of you?
I'm happy to share, but Mom, I'd love to hear what you think.
Well, how did you feel when they came to you and said, hey, we have something new that may work. Are you willing to try? I mean,
Which is very interesting because I had already went online and read up on this treatment. I'm a little proactive sometimes.
You have to
Sometimes
be.
when I don't know things, I just look things up, but I had heard it. It came through my email because I'm a part of another organization, and I went on and looked on the NIH website, and I looked that they had this new treatment, and so when they came to me, it was interesting because this day at the appointment, I actually was going to ask a question about it. So when the bone marrow transplant team came to us, it was very interesting. I thought, like, look at God. You know, look how he worked, because I had already had touched surface with it, and when they approached it to us, because that was the question, are we doing it here in Wisconsin at Children's? And they was like, funny that you asked, because we just got the okay. So I was like, great. Trey and I talked about it. We got a little information from the hospital. We went online, listened to some stories online. Of course, Mom did a little bit more research about like the medicine that they use and the procedure and stuff like that. And I asked him if that was something that he was interested in doing. And he's like, well, I don't know. What do you think? And I was like, well, this is your life. So I wanted him, he's going into adulthood, so I wanted him to make that life-changing decision for himself, because we're getting in that stage where you got to make those decisions for yourself. So I said, hey, it's up to you, bud. This is what we got, and this is the information we got. What do you think? And he was like, I think I want to try it.
so you will be the first Children's Wisconsin patient to try this new treatment. How do you feel about that?
It's kind of like nerve-wracking because like you see like a stone like everybody else in Wisconsin and everything, and so I'm pretty much kind of like being like a new face to like a lot of people. So
What are your interests growing up here as a soon-to-be 18-year-old man? What do you like to do?
I like to play football. I like to build robots. I like to play games, video games.
Yeah, all the stuff that a normal kid would want to do at your age, and so you're being able to do that thanks to the care here at Children's, which is great.
Yeah. What do you want to say to all your doctors? I see there's a bunch of staff here watching. Can you see them all?
Yeah, I would say thank you just for like supporting me throughout the times, like in my ups and downs, and like always supporting me. Just like knowing like people who have my back and everything is like feels good. So like I would just thank them.
And what would you say if there's a kid listening today that may have sickle cell and they're scared too? What's your advice to them?
I would say put more trust, like pray to God a lot, because when I was like in hospital more often, I always like lose faith in God and see like why He always like done this to me and everything. Because like around my friends, like they're like barely be in the hospital and everything, but I'm always like there for like a week or two, and so I feel like I started it. But I just like to say keep your faith in God and yeah.
And in your doctors, right? You're a brave young man. Thank you for sharing your story today.
Thank you.
All right, so Trey has gone on from having some issues to being able to lead a normal life as a young man, which is great. If you'd like to help others like Trey, you can call the numbers that we've given a lot, 414-337-WKLH. You can also text WKLH to 51555.
Please, we need your donations.
Thank you. Really appreciate your time.
Thank you.
Thank you.
We continue with the 27th